if you like, to the managers and directors of the hospital that we should protect the information of our patients, and we should work on that. Limit sharing of information to other staff unless it's for consultation and second opinion, as we will see in a minute. For error records, never inappropriately access records. Shut, lock the doors in offices and filing cabinets. It's very important to keep them in a closed places. Query the status of visitors and strangers. If you see someone, not just because he's in white coat and he has a stethoscope around his neck, then he can go to know if you are the doctor or even a nurse, then you should train the nurse and tell her if anyone comes, you should ask him who you are. Even he said, like, I'm Dr. X, and who are you, and what does it have to you to relate to the patient's condition. Advise senior personnel if anything suspicious or worrying is noted. If you feel that there is a leak of some information of the medical information, you should notify that. For manual records, hidden secure storage like a closed cabinet or closed rooms and archiving, tracked if transferred. Some hospitals, or I'd say most of the hospitals, have like this barcode kind of thing. They can follow where the medical record is and who took it. Return to the filing system as soon as possible after use. Just as when it's finished, the doctor finished the use of the medical file, then it should go back to the medical records. It's stored close and not to be used, so the contents not be seen by others. That's to say, just don't leave the files on the nursing station, for instance, where you just open the medical file and people passing here and there, and they can have a look on the file. Kept on site unless removal is essential. So it's better to keep it unless you have to. If it's electronic record, that's to say it's within a system, okay, then you need to make sure that you log off your computer as soon as you're finished. Don't leave your computer unattended and logged in. Don't share smart cards or USB and passwords with other colleagues. Change passwords at different times. Always clear the screen on previous patient information. Don't leave the screen. If you open like a system, the Cortex system or whatever, and with information for the patient, just try to always to close the screen before going. Emailing is a good way because you can attach the results, attach investigations, but it is dangerous actually because hackers can just take your email and disturb your life. Actually, it happened to me twice. It was so disturbing. So basically, try to avoid sharing confidential information through the email or even faxes. So basically, if we want to define what is the medical secret or the profession secret, السر الطبي as it's called in Arabic, it includes any information that the doctor or the treating team, it's not just the doctor, knows about the patient, alive or dead. And it's very important actually. Sometimes we think that, okay, the patient is dead, we can talk about him as we want. No, it's not, because sometimes you can harm his family. For instance, if he died out of like say sexually transmitted disease, let's say HIV/AIDS, and his family lied about his condition, said that he died of cancer or died of pneumonia or whatever. And if you start talking like that, it could happen that someone who knows the deceased patient and start telling other people about his condition. So the patient again, the reference whether it's important or not, the patient should be the one to ask, do you think that I can share this information or not? So it's important that the patient be involved in that. It includes any information about the patient's identity, condition, diagnosis, investigation, treatment, prognosis, etc. Okay? When to disclose a medical secret? When to breach the confidentiality of our patient's information? First, if you have approval from the patient, if you ask the patient, can I share your information with my colleague for a second opinion? He said, okay, go ahead. Do you mind if I tell this family member about your condition? He said, okay, go ahead. But I don't think it's a good, like, okay, I'm going to put a copy of your medical file on my Facebook account. Most probably he would say no. Anyway, so it's for the patient to decide whether he wants that or not. If you are required by the judiciary, if a judge calls you, you are the doctor, you are the expert, and he asks you for expert opinion, or you are treating a patient and this patient is involved in some sort of criminal act. So basically, you should be there. For consultation or second opinion, yes, you can disclose some of the information. Notification of events, this is very important actually. Even if the patient refuses, it's your duty as a doctor to notify the notifiable diseases. The MOH, the Ministry of Health, has a list of notifiable diseases, as notifiable diseases that you should notify. Some diseases should be notified within 24 hours, some on weekly basis, some on monthly basis. However, it's your duty that, especially the highly infectious and the outbreaks and endemic diseases. Prevent individual or personal threats like crimes, and it's also important that if you find the patient that he has criminal intention towards his a family member or a friend or something, so it's important that you notify, I won't say the police, but at least the administration of the hospital to take action to protect other people, if needed by the doctor to defend himself or herself. For instance, if the patient submitted a claim even here to the Saudi Commission, like this doctor he made a problem or he made a mistake, and then you come and you say, like, oh, it's okay, this is a medical record of the patient, I've done this and that, I've done this and that, just to defend yourself in case in the discipline committee and before a judge. Some people say that it's for the doctor to disclose some or all of the secret if this is necessary for the cure of the patient. Actually, I don't feel comfortable for this, because simply it's not you who should decide whether, I'm not sure yet, but I don't think the doctors should depend on that a lot. I mean, I thought that this is good for the patient to disclose it, and so I told everyone about it. So basically, we will end up with few questions that we should have in mind. Have you ever seen a patient fully exposed in front of dozens of eyes and pairs of hands in a clinical round? Yes, our patients, unfortunately, are being examined like with 10 residents and medical students around them and being exposed. A patient being photographed without consent, it happened. Some of my medical students did that, unfortunately. A couple of doctors chatting about their patients over lunch or in the lift. They talk about, oh, have you seen this patient? Yes, his name is this and that, and yes, what's his problem? His problem is that. So everybody in the cafeteria or anyone in the lift knows everything about it. A doctor relative of the patient having a look on his relative's medical record. As I said, being a doctor does not grant you the right to have a look or to look through the medical records. The student approaching patient with questionnaires without consent or institutional approval. So don't do that. Respect your patient's privacy and confidentiality. Thanks a lot.